This video has been brought to you by GoFiber, hair building fibers that can make your hair look thicker and better. And there is a link in the video description below where you can visit GoFiber, get a free sample of your choice and try them out. See if you like them. Welcome to Let's Get Hair, everybody. In today's episode, we'll be talking about finasteride. What will be the best practice? What are some things that you need to consider when taking finasteride in the long run? We'll be discussing it with the hair transplant doctor Bhatti from India, who is joining us today, and he has been actually using finasteride routinely in his practice for almost 15 years. He has been an active hair transplant surgeon for 18 years, and he's prescribing it to almost all of his patients post hair transplant. We'll be touching on two aspects like what is the optimal dose of finasteride if you want to minimize side effects, so how to avoid side effects on finasteride, essentially finasteride versus Dutasteride, and also things like post-finasteride syndrome, many things around TRT and finasteride, and also different kind of setups around customized dosing of finasteride, but also interesting topics like taking finasteride when making a woman pregnant. And I specifically decided to choose Dr. Bhatti for this discussion since his very extensive YouTube channel with more than 1,000 videos related to hair loss and hair transplants that he has already published, especially the ones around finasteride stuck out to me, like his video 5 strategies on finasteride that any user needs to know who wants to minimize side effects, and also his microdosing finasteride video, as well as his complete guide to finasteride. All videos are highly recommended, and right now I would like to welcome Dr. Bhatti, and I'm glad he's here so he can share his knowledge with us.
Hello, Mr. Matt. Thank you for having me on the show. It's always a pleasure to be with you on your interviews. You're doing a tremendous job guiding patients with hair loss and giving your advice to patients who are seeking hair transplant so that they do not fall prey to the big market and to all the clinics that have sprung up all over the world, which are doing unethical work. And your channel sticks out as one of the most reliable channels across YouTube dealing with hair loss treatment and hair transplant recommendations.
Awesome. Thank you very much. Appreciate it. So our first question will be essentially like, what is the optimal dose of finasteride in your opinion? We know it's 1 milligram. Any doctor who is prescribing physician will tell his patient to take 1 milligram a day. But based on your experience and based on your 15 years of prescribing it, what would be your answer to this?
See, I would divide this into two broad categories. One is patients seeking hair loss treatment, and the other one is patients after hair transplant being recommended finasteride. So the dosage and the recommendations are different for both. Whereas there is a lot of scope for experimentation when we are treating hair loss. After hair transplant, there is very little scope because the margin of error is very less. You would agree with me that only in hair loss treatment, when we can start off with a low dosage and see where over a period of 3 months to 1 year, where the patient's sweet spot is, which is around somewhere between 0.5 milligram to 0.8 milligram on alternate days. Now, we don't get 0.8 milligrams as a package dose, nor is it recommended to split the medicines because the actual dosage might vary. So it is 1 milligram for practical purposes. 0.5 milligram is the dosage that I usually start with on alternate days, and I gradually over the next 3 to 4 months, that is in the next one hair cycle, by the time new hair has sprung up, I decide whether to switch to a higher dosage or not. And most people benefit by either of these two dosages. So this is customized dosing. Every patient has a different dosage of Propecia or finasteride that would benefit him and make him have a head full of hair through medication. But you also have to see what is the age of the patient. If the age of the patient is, say, 23 years old and he's rapidly progressing towards baldness, would you like to take a chance with a low dosage? No, I would not like to. I would like to stabilize the baldness as fast as possible with all I have, and then after that gradually decrease or wean off the patient to a lower dosage that will benefit him and his peculiar metabolic system without the optimal dosage with minimal side effects.
So in case of more aggressive baldness, somebody who is very young, you would like to start with the highest possible dose, ideally, so you can stabilize it quickly and then go maybe less in the future.
Exactly. And many times I've found that people who are around 20 years, 21 years old, aggressively balding, even 1 milligram a day does not suffice. So in these patients, I like to put them on once a week Dutasteride, 0.5 milligram on weekends, say Saturday, and on Saturday I omit their finasteride dosage.
So we will talk about Dutasteride more in another question, because that's something that's more potent than Finasteride. And as Dr. Bhatti already said, some people will not see stabilization with Finasteride because their hair loss is too aggressive. And in such case, there will be another addition of Dutasteride. But that still means taking Finasteride on other days, but adding Dutasteride on another specific days a week. So you would essentially say by an average maybe hair loss progression that is not super quick, it's not super slow, that it's also enough to start with 0.5 every other day and then see how it goes for about 3 to 6 months and then adjust from there.
You're right.
Yeah, that also goes hand in hand with the general recommendation of other doctors on the hair loss show from Australia. They're also proponents of taking 0.5 milligram every other day for people who are already worried about the side effects, which actually can exacerbate the side effects experience in itself. So it's actually better for these people to start with less, since they already maybe are making themselves more susceptible mentally towards the side effects. So that's actually a smart thing to do. And I would agree with that definitely. Personally, I started with 0.5 milligram every day back 4 years ago. I also used it. I never used 1 milligram a day. I either used 0.5 a day or 0.5 every other day, and it also worked for me without losing efficacy, and it kept my hair. If somebody already has side effects, if this is the case, is there any way, doctor, to minimize them in the future? And maybe you can also comment on to some of your strategies that I find very unique that you mentioned in one of your videos. Very good video. And you had 5 strategies that you kind of propose for minimizing side effects. So that's very interesting. So maybe you can go into that a little bit.
So Mr. Matt, I would like to add that Propecia Finasteride is not for everybody. Everybody cannot tolerate this drug for many reasons, psychological or organic. And today's population is generally sedentary in nature. Youngsters are sedentary in nature. They're stuck to the computers, working from home or working all the time on computer and very little exercise. These youngsters today have usually low gonadotropin hormones, low sexual hormones. So if you do not have enough testosterone, male hormone, enough drive which comes from your testosterone hormone, this medication can play havoc with your libido, with your sexual life.
And here I would also like to refer to a nice page, testosteronedecline.com, where you can actually check where your country ranks in terms of average testosterone levels. And the guys who are behind this page are doing a wonderful job. They're updating this page very frequently. There was last update done on the 3rd of November this year. And what they do, they pretty much pull up hundreds of studies from all across the world, and they look at the testosterone levels in all of those studies. And based on this data, we can also see how rapidly testosterone levels have been decreasing over the last decades. You can also check how your country has been doing over the last 3-4 decades. So if you look it up here.
So the case selection before putting a patient, exhibiting a patient with finasteride has to be proper. It cannot be that a patient takes this medication over the counter. As it is not an over the counter drug, but many countries it is freely available. So it is not to be taken lightly. This drug has to be taken under supervision of a competent doctor who has been treating hair loss for several years. This drug comes with side effects, but if a patient is counseled properly, if biochemical parameters are taken into consideration before starting the drug.
You would recommend somebody to do a specific screening before taking finasteride?
Before taking finasteride, I would like to get, number one, your testosterone level, your estrogen level, your BMI, your sperm count, to rule out everything that could be wrong. Later on, a patient can ascribe these to taking finasteride. So to rule it out, once you start the medication, then you can't say what it was all due to, because people talking about PFS. What they lack is initial biochemical parameters which were not done. Total testosterone level done and estradiol level done to rule out hypogonadism, because these are the people who as it is have side effects, and they just need to take finasteride and just need to watch a few videos online, and they will end up with a problem.
You started about BMI, that's body mass index, for people who don't understand it. And you mentioned in one of your videos that you don't advise taking finasteride for people who have a certain body mass index that is, I believe, 30 or higher, which means like obese or overweight individuals, because we see in those individuals experiencing also other diseases like diabetes, hypertension, potentially depression. And these are also factors that correlate with higher occurrences of erectile dysfunction. And that might be also then the reason why these people have those side effects, may not be necessarily also related to finasteride. So that's why Dr. Bhatti likes to rule those people out who are already quite susceptible towards developing side effects from finasteride. Not even talking about that, these people have, a higher body fat percentage, and we know that aromatase is also being expressed in fat cells, and that's something that can actually make people more estrogenic, since that's the hormone that converts testosterone into estrogen, and thus could also increase the side effect occurrence that people complain about. Now, if we come back to PFS, post-finasteride syndrome, you as a physician who has been prescribing this drug for more than 15 years right now, are you a believer in post-finasteride syndrome? Have you encountered this phenomenon with your patients or not?
Mr. Matt, I am not a believer in the PFS syndrome, the post-finasteride syndrome. I don't think it exists. You can't blame everything on finasteride. When you have not baseline testing, lab testing, baseline sperm count testing, everybody is not healthy. You expect that you are taking for granted that you are healthy. 40% of people have low testosterone level, Mr. Matt. Do you know that? 40% is a big number. And the number of people who have impotence, people who have, infertility is on the rise. Now, you can't say that you are infertile because of finasteride. There is a huge population which is not taking finasteride and is infertile. Now, what happens to a person who's not got his baseline testing done and ends up infertile, ends up impotent? He can't blame it on finasteride. And if he was infertile, if his sperm count was low, if his testosterone levels were low, if his estrogen was high, where was the need of starting him on finasteride? Health is far more important than your hair. There are many options available if you don't have hair besides hair transplant or medication. But your health is more important than your hair. That's what I feel. I've been prescribing routinely. I think I insist on each one of my patients to take finasteride. Some do follow my advice, some do not. But I have seen that it is a very rare phenomenon having side effects after finasteride. It's extremely rare. Yes, people have it initially in the first few weeks, but they get over it as the body adjusts to the new changed milieu interior, the new hormonal balance. The body adjusts. They get over it in 4 to 6 weeks. They just have to be patient.
Exactly.
Also, it goes hand in hand with the randomized controlled trials done on finasteride, especially. I'm going to link it or pull it up on the screen somewhere. There was this 4-year placebo-controlled study done on 1,524 patients where they observed finasteride versus placebo side effects as far as impotence, libido, ejaculation, and all these problems. And interestingly, the finasteride group was a little bit higher in terms of occurrence of side effects in percentage, maybe 2 to 3% higher than the placebo group. That was in the first year, but in the second, third, and fourth year, it started to decrease, whereas, funny enough, the placebo group on some aspects actually started to increase. So it was, for example, in impotence, the placebo got actually higher over time, whereas the finasteride group got actually lower. So that's something that we can see, and it's interesting that you are seeing the same in your practice. So if somebody has side effects, maybe even mild ones, like maybe some pinching in the balls or in the chest area, in the nipples, where people maybe get, or some odd sensations initially, they tend to usually resolve with the time, right?
So many times patients ask us, why such a dangerous drug you're giving us. See, we are not the patient's enemy, and we are not profiteering from finasteride. Finasteride is such a cheap drug. It hardly costs $10 a month. No doctor would be profiteering from prescribing finasteride. But a doctor would definitely prescribe a medication which gives results. There is no alternative presently. No drug which is even close to finasteride in sustaining, retaining your hair in the long term.
So what would be maybe like the youngest individual you have ever prescribed finasteride? What is your limit where you start prescribing it? Because we know the DHT importance in adolescent and pre-pubertal, development of sex organs and sexual male characteristics. So what would be the age limit?
So finasteride is an FDA-approved medication for hair loss for last almost 30 plus years. And this medication is advised to be taken in males who are 18 plus, over 18 years of age, not any lower. But I go a step further. I do not prescribe this medication to those below 21 years because the sexual characteristics, the secondary sexual characteristics which are determined by DHT are not fully developed in the male till he is 21. So I would not like to put the patient on finasteride till he is 21.
Understood. So do you also see higher occurrence of side effects by certain age groups? Maybe younger guys are reacting differently to older guys?
Older people have less side effects than young people have, I've seen. Young people are more obsessed with their hair loss, and young people are more obsessed with taking finasteride. They'll be all over the internet and searching for all side effects. And the mind is so powerful, Mr. Matt. If you search for this, your mind is going to convince you that you have a side effect. Sex is in the mind. A person who does not have a robust mental makeup, as it is, he's not a candidate for finasteride. Let me tell you. This is not a medicine for the meek.
For the meek? It's for somebody who is very timid and not feeling.
Yes. Yeah. Who gets carried away by his friends, his relatives, and what he reads on the internet, and is very fearful of everything that he suspects might be true.
Totally. A huge mind game. We have the studies done on nocebo phenomenon, that people who were counseled on the side effects about finasteride previously versus the ones that were not. These ones had much, I don't know how many fold higher chance of experiencing those side effects in the end. But it was a big number compared to the group that didn't know about the side effects. Maybe you could just elaborate on one of your strategies that you mentioned in your video that you like to recommend people to minimize side effects from finasteride. And one thing would be the make the peaks coincide. That's something that I found interesting, but I did not really understand it because you mentioned that we all know that the testosterone levels, they peak in the morning between like 6 to 8 a.m. in the morning. And then you also mentioned why this is important for taking, can you maybe elaborate on this more?
So I recommend that the patient should take finasteride before going to bed, and usually around say 11 o'clock. Most people sleep around 11 o'clock or between 11 and 12. So that is the time when they should be taking finasteride, not in the morning, not in the afternoon. Because if you're taking in the afternoon or morning, you'll need to take a higher dose to suppress the DHT. And if you take it at night, even 0.5 milligram taken on alternate days will work as 1 milligram taken daily. Why? I'm going to tell you that now. The blood concentration of finasteride peaks after about 6 to 8 hours. And according to the circadian rhythm, that is how hormones are secreted in the body. According to the circadian rhythm, the testosterone surge in the body happens in the morning between 6 to 8. And this is the time approximately the surge of testosterone hormone and the peak concentration of finasteride in the bloodstream should coincide. So once it coincides, the drug is better able to suppress the androgen hormone than it would if taken in the morning. So this way you can minimize side effects by taking minimum amount of dose late at night, say around 11 o'clock, and with 0.5 milligram get the benefit of 1 milligram daily.
Yeah. Wow, that's interesting. Yeah, I was never thinking about it this way. So that's something that I would definitely try out next time. Right now, I'm using the topical finasteride, but if I had been still on oral, I would have definitely tried this out because it sounds definitely like a good optimization thing to do. Another thing you also mentioned next to customized dosing and next to the coinciding of the peaks was the switch off technique. Is it something that you have, when did you start looking into the switch off technique? When did you start noticing that may be a good thing to do for making the side effects smooth in the long run?
So since 2015, I think, since 2015 or 16, I started experimenting with switch off and switch on technique. That is, you take the medication. I'm not talking about the medication after hair transplant. After hair transplant, I recommend 1 milligram for straight away 6 months. There's no break because we have to grow the hair first and then think of lowering the dose. So we should not compromise after hair transplant. But when you're treating hair loss, then once we have achieved an optimal growth in between 6 months to 1 year, after that we should reduce the amount of residual drug in the body, the buildup of finasteride in the tissues, by taking breaks 2 to 3 weeks every 3 months. Now this washes off the excess of finasteride, the built up finasteride in the body, and this also decreases the side effects. The other benefit of switch on technique is that the body gets used to finasteride in the over a long period of time when you're using it in the long term. So the hair, the body is far more intelligent than we are. So it adjusts its receptors in a way that the receptors stop responding to finasteride. So the best way to do it is to make the receptors switch on and switch off by taking a break of 2 to 3 weeks. Every 3 months you're on finasteride.
So that would essentially mean that a person would be maybe 8 to 12 weeks off of finasteride per year. And then the rest of the time it will be on finasteride. Interesting.
Yeah, it works very well because I'll tell you one more thing. Many people ask me that the finasteride, it gets washed off in 6 to 8 hours from your body. Well, it does get washed off, but the effect of 5-alpha reductase, the half-life of 5-alpha reductase is much longer. It's about 30 to 60 days.
Yep.
So it remains suppressed for about 3 weeks, definitely.
So it's no need to be suppressing it continuously.
Yes, there is no need. So basically, every 3 months, it is very essential that you take a break of 3 weeks. There'll be no harm. You will not lose any ground.
So that's a very valuable information you don't hear often from an average doctor who is just giving you the prescription without any counseling, without any information around it. And that's oftentimes what I hear from guys that I consult one-on-one, that they just get a prescription and then they don't get any information around it. And that's pretty much where people get stuck, and then they start thinking whether they have done a good decision as far as jumping on finasteride without, knowing a lot of things about it prior. So this would be mainly like an example of one of my subscriber who sent me like a question, like he is using finasteride twice a week, every 3 to 4 days. Not sure how much he's using, whether 0.5 or 1 milligram, but he's saying whether it matters if he uses it more frequently, like 0.5 milligram every 2 days or even 0.25 milligram every day. So what would you say to this kind of
0.25 milligram dosage is an apology of a dose. I don't think it ever will work. There are people who swear by this dosage. They say that it does work. And so I tell them that you stop this medication for about 3 months and you'll see you still won't have any hair loss. Your baldness is stabilized. If 0.2 milligram is benefiting you, your baldness is stabilized and you don't need to take finasteride anymore. Because you have to be on minimum 0.5 milligram on alternate days for it to have any effect if your baldness is progressing.
So do you think it's a difference versus 0.5 milligram on alternate days versus 0.25 milligram every day?
0.25 milligram every day. I haven't tested it ever, but I think there should not be any difference because the 5-alpha reductase enzyme, it blocks, its half-life is longer.
Plus, if we look at the serum DHT reduction percentages, with 0.2 milligram, there is a 69% reduction, and with anything between 1 and 0.2, it's also around 70.
Yeah.
Essentially the same reduction that you get.
Should be the same.
The finasteride concentration in your system will be higher in general if you take more, of course, and that's pretty much gonna cause that accumulation, and then you can probably take some time off of it for longer and still not lose hair. Maybe that's gonna be the benefit that you get.
Yeah, people who are taking 0.25 milligram of finasteride, I will advise them to take it late at night and it will benefit them even more.
Okay, so there you go. Everybody who's taking 0.25, because I know many of you are taking it, so it's better to use it at night, as Dr. Bhatti says, because of the coinciding the peak proposed theory and improvement that Dr. Bhatti has done. And I'm going to link some of your videos below so the guys know exactly what this is about. Now, how about the cousin of finasteride? That would be Dutasteride. So is it something that you would routinely make patients start with, except like let me formulate it differently. Would Dutasteride be something that you would prefer some patient to start and against finasteride?
I have had a recent rash of patients who want to start themselves on Dutasteride and not on finasteride, Mr. Matt, because there's so much of literature about side effects of finasteride, but not on Dutasteride. Dutasteride is not FDA approved for hair loss medication. So a flip side to that is that people who want to make a quick buck by suing the company will not be able to sue the company for Dutasteride because they are taking it for hair loss as an off-label medication, as an off-label prescription. So you will never see the name of Dutasteride sullied as much as that of finasteride. This itself raises so much of suspicion about the motives of people who write about finasteride so much. I do not use Dutasteride as the first line of treatment for treatment of hair loss, and I do not use it as a daily medication for treatment of hair loss. I use it only to supplement the effect of finasteride by putting it in the regime once a week. See, Dutasteride blocks almost all your DHT, 95%, whereas finasteride blocks about 73%. Now, hormones are there for a reason. They're not bad hormones. They have got a purpose in your body. So, to my mind, blocking all your DHT for a very, very short-term gain, having hair for some more years and taking no cognizance of your health, I do not think that is the right way to go. I think one should not go beyond finasteride. If you must, it should be under medical supervision once a week, Dutasteride, not more than that. I do not recommend.
It gets the good out of both worlds. You're not just, just pro-finasteride and against dutasteride. You are also like pro-dutasteride, pro-finasteride, but make it kind of balanced. And you also try to follow the FDA-approved guidelines, and you want to start with finasteride because it's approved and not like dutasteride that it's not, of course. So that all makes sense. If we talk about having children and guys probably who are in their 30s now thinking about reproduction, and I get messages like this on a regular basis, these guys are wondering whether it is like 100% safe to have children while using finasteride, or is there some optimizations they need to do, because there are some sources telling them it doesn't matter. Some people tell like you got to get off of it for some time before. So what is your opinion on that, and what are the results of your patients who maybe used finasteride while impregnating their partners?
So finasteride is a class X drug. It is a teratogenic drug. It can cause developmental anomalies in the fetus. So it is not to be taken while you are attempting to start your family, while you are trying to make your partner pregnant. When you're planning a family, you should stop this medication minimum 60 days before planning to conceive. And even after, you should keep it away from your partner, because mere handling of this drug has been noted that it can cause fetal anomalies. So people ask that finasteride half-life is just about 6 to 8 hours, so it gets out of the body in 6 to 8 hours. No, but your wife, your partner can touch this drug and consume it unknowingly as well.
So you would say it's safer to be off of it 60 days before, and then during the pregnancy, if the wife is already pregnant, what would be your advice to men? Because they already probably want to get back on it since they want to keep their hair. So how should they approach the safety of taking it during that time?
See, as I told you, that the half-life of 5-alpha reductase, which has already been inhibited by finasteride, is much longer, 30 to 60 days. So it will really not affect so much. But even if it affects a little bit, you should take it in your stride. You should stop this medicine 60 days before impregnating your wife, before she conceives. And even later in her first trimester, that is in the first 3 months, you should not be having this drug at home. You should dispose it off or keep it in your office.
So have you seen or have you read some papers or some anecdotal reports when this was maybe not fulfilled, and some patients just used it not knowing that what can happen, and there were some issues as far as disruptive?
No, there is no paper on this, but it is listed as a class X medication which should be avoided before planning a pregnancy.
Is it something that they state on the paper as well, like the 60-day period, or is it something that you recommend as a doctor?
I think on the Merck paper, they say that it should be stopped before trying to conceive a child, but the duration is not mentioned.
So it's good that we have at least some time frame for all of you watchers, 60 days. That's what Dr. Bhatti suggests. And I think you have already probably suggested it to many of your patients as well who used finasteride and then were able to make their wives conceive, and the babies came out healthy, right?
Yes.
Another question, staying still on topic of conception and impregnation, it will be fertility, because fertility is also a side effect that is being reported in some studies on finasteride and dutasteride. In dutasteride, it seems that fertility is being more severely affected. What was your experience like with your patients? So did they have some issues with fertility while on finasteride, and then once they stop finasteride, the fertility markers got better as far as sperm motility, sperm counts, and they were able to conceive more easily?
I have not, Mr. Matt, ever encountered this problem, because I have very strict criteria before I put the patient on finasteride. It's not a drug which is to be taken very lightly. So I have very strict criteria, and I have not come across any patient who's undergone testing and who's not been able to impregnate his wife and make her pregnant. The most important thing is to be in touch with your doctor all the time.
I would probably still want to do a sperm test just before trying, because many people don't do it and they try to have a child with their wife or partner for many months and then they wonder why it's not working. It's much better to do the sperm test before, so you at least know that there is no issue with you, and then your sperm volume and sperm motility and morphology are high enough, and then you are pretty much good to go, right?
40% of men have low sperm counts, and people blame it on finasteride. Normal healthy men not taking finasteride who do not have hair loss have low sperm count.
Yeah, it's a really epidemic, like with all of those microplastics and all of those endocrine disruptors that are being found in the food and in the environment, in the cosmetic products that we use to clean our bodies and all these things. And then unhealthy lifestyle and all these factors can play a huge role. And actually the trend, once I looked at the WHO statistics, like the sperm count are definitely like decreasing severely since like the 70s, 80s, since the baby boomer era, and it's not due to finasteride, because finasteride has been approved only in the late 1990s. So it definitely, the trend started already earlier before and still continues regardless of whether finasteride is being prescribed or not. So the last question, Dr. Bhatti, will be a combination of TRT, testosterone replacement therapy, or HRT, hormone replacement therapy, and the combination of this with finasteride. Now, I don't know how common HRT is in India and whether you have many patients that are using this therapy in combination with finasteride.
Yeah, so TRT is picking up in India as well, testosterone replacement therapy. Many patients are taking TRT, and these are the patients who are prone to greater hair loss. And it is further compounded by these people doing powerlifting in the gym, taking whey protein. That's another interview we can do about whey protein later. And then a lot of hair loss happens with people on TRT. It's an accepted fact that people who are endowed with the gene for baldness, when they start TRT, they have a lot of hair loss.
Do you think it has something to do with the fact that TRT, especially in the beginning when the body is getting used to it, they're being injected with, they inject testosterone, maybe it's 100 milligram, maybe 200 milligram, usually less than 100, but they inject it once a week, all at once, which is not natural because your body is producing like only 5 to 7 milligram a day, and then you just inject 100 at once. So do you think it creates that shock that causes that shedding?
Yeah, I think this could be a reason, but androgens in high concentrations, and especially these unnatural androgens, will cause a lot of hair loss. I haven't done much work on this, but I have a lot of patients are coming to me with TRT now, and they benefit with finasteride.
Are you seeing that finasteride is helping guys who have never used it?
Finasteride is definitely helping people who are on TRT and have very aggressive hair loss.
Would you be a proponent of the maybe higher or approved dose of 1 milligram in that case to stabilize it?
That depends upon how much hair loss the patient has and how much finasteride he can tolerate. It's not that 1 milligram for everybody. Some people might benefit with 0.5 milligram as well. But if he's having very aggressive hair loss, I would like to start with finasteride daily and perhaps once a week Dutasteride, and then scale it down.
Mm-hmm. Yeah, and then scale down to avoid potential side effects from it.
People on testosterone level, if it is optimally given, have very less side effects, sexual side effects, once the TRT starts to respond. Yeah.
They usually get above average testosterone levels, or even exceptionally high testosterone levels, clearly higher than they had before, and that will make sure that all of the sexual function and libido is working well in the body despite using finasteride.
It does definitely gives them boost in their libido, and finasteride side effects in these patients are minimal.
Do you think that TRT might affect affect transplanted hair also?
TRT without finasteride, I am sure it will affect transplanted hair as well. Yeah, it will. I mean, in the first 6 months, it is very important if you're on TRT to take finasteride. All the more important if you're on TRT. Otherwise, a lot of hair might not grow. See, it's a myth that the hair at the back of the head and the sides is permanent. It is just a myth. It is a marketing gimmick. Nothing is permanent in your body. Your body itself is not permanent. How can hair be, how can hair be permanent? Every hair, even at the back of the head, has a receptor for DHT and it responds to DHT if you have the baldness gene. That is why people have this aggressive form of baldness that is called diffuse pattern alopecia. So every hair has DHT receptors and every hair is responsive to DHT if you carry the male pattern baldness gene. It is relatively permanent, not completely permanent. So in a scenario where you are on TRT without finasteride and you plant hair, they are going to thin out like the rest of your hair with TRT.
Are you seeing it with some patients who are maybe not that not want to behave in a way that they would follow the protocols and they want to do it their way and they don't listen to your advice and they are on TRT, they do a transplant, then stop finasteride, and then you see them a couple of years later and the hair is visibly thinner?
Yes, increasingly there are clinics which, they are pandering to the patient's fears. They say that, you don't need to take finasteride. Hair transplant, this is permanent hair, it will survive. But that's, just seeking out patients so that the patient doesn't run away and pandering to the patient's worst fears and not wanting to lose a client. They also know that without finasteride, all the hair will not survive. Even if it grows out in 6 months, one year, it's going to fall out soon. That's why most clinics do not publish long-term results. How many long-term results have you seen, Mr. Matt, on the internet after hair transplant, which has gone wonderfully well?
Long-term, how many years would you define a long-term result?
5 years.
I have seen a few.
Very few. So these are the patients who have not been guided properly, who have not taken finasteride, and who have been very casual as far as medication for hair loss is concerned.
I don't know if you created a statistic as far as like how many guys percentage-wise get side effects, or if you prescribe finasteride 100 times to patients, like how many of them get some side effects you would think?
See, patients need a lot of psychological support in the first 1 or 2 months after starting finasteride. You have to tell them to hold on, be more patient, and they usually more or less they agree. 30% patients after starting finasteride will have some sort of side effect, momentary side effect, transient side effect for about a month or 6 weeks, like tenderness behind the nipple, testicular pain, some gynecomastia, little puffiness of the face at times, some dryness of the eyes, brain fogginess. But this will go away in 6 weeks' time as the body adapts to the new changed hormonal milieu, hormonal environment. But this is about 30% in my practice I've seen. As far as side effects are concerned, later, most of my patients, I think it will be less than 0.5% patient because I screen my patients properly, as I told you earlier. I am very, very careful whom I give finasteride and whom I do not recommend finasteride, and sometimes don't recommend hair transplant if you can't take finasteride also. So that is very little, I would say less than 0.5%. It is 2% in the normal population, but if you screen the patient well, it is very little. It is almost non-existent. Yeah, you have to be very strict in whom to give and whom not to give. It is not a drug which everybody can take.
After your screening that you do, which is very thorough, I would say, compared to an average doctor prescribing this drug, even despite of all this, still about 30% can still get some, transient side effects in the first couple weeks, and then they will resolve by most of them.
Yes. 30%.
Okay, fair enough.
Side effects that last longer than 4 weeks, 6 weeks, less than 0.5%.
Okay, and if they last more than 6 weeks, then you start already adjusting the dose, or you still wait for 3 months?
Oh no, I will tell him to stop it. Why take a chance with your health?
So you either are meant to respond to it or not.
Yeah, but Yeah, Mr. Matt, only thing after hair transplant, if a person has side effects, say after 3 months also, I will still encourage him to take it for another 3 months. Because he's got a hair transplant and all the hair should survive. Because the resource from where we harvest the grafts is limited. I would advise him to continue to take the medication, be a little bit more patient for another 3 months. That I would do. I would go an extra mile in trying to motivate him into taking finasteride, because I know that every test is normal and it is having his mind is creating this problem, which he thinks is a side effect, but not for hair loss sufferer. For hair loss sufferer, I will advise him to just stop medication. No, I would not advise him to take it.
Yeah, I'm very happy that you joined us today, and we'll stay in touch for some next collaborations in the future, and hopefully the responses to this video will be really good. Have a good evening, Dr. Bhatti.